Good afternoon. We had some beautiful weather this weekend, and I know it's tough to keep the kids inside. Many are taking the medical advice seriously, but others continue to ignore it. There are extremely serious consequences if we don't stay home. All we have to do is look at New York, Italy, or Spain. And here in Ontario, we have 1,600 lives at stake this month alone. This is a matter of life or death. And the reality is, our supplies are strained right at this moment. We know that the U.S. isn't allowing supplies across the border, and as the global demand escalates, getting supplies from other countries is increasingly difficult. We're doing everything in our power. We're exhausting every avenue available to us, turning over every single stone. But the hard truth is, our supplies in Ontario are getting very low. And the more new cases we get, the more demand is placed on our resources. And how fast this virus spreads is up to all of us. It's up to every person in Ontario to listen to the experts, to stay home as much as possible. So please stop the spread of this deadly virus before it affects someone close to you. And for many of us, this week means a celebration of Easter and Passover. Whatever your tradition or custom, keep it alive, but please keep everyone safe and healthy as well. Stay home. Don't go out except to pick up groceries, prescriptions, or go to a medical appointment. This is about saving lives. And I know how difficult this time has been for families and for people as well. I know that daily routines have ground to a halt. And as a father of 4 daughters, I know how difficult it is when there's a sudden change at home. I want to take a moment to say thank you to our teachers. I want to thank you for your hard work in keeping our children on track during this challenging time. I know many parents are adjusting to these changes, and it is critical that during this time, kids keep learning. Education must continue, and we're taking every step possible to make sure this happens. And we're doing everything we can to support parents during this challenging time. We introduced job protective leave for those who need to stay home while schools and daycares are closed. We've reduced the price of electricity to help offset the added cost of being home all day with your children. We now have 23 child care centers open to provide free child care for our frontline healthcare workers and first responders. And starting today, we're providing some direct support to help with the cost of keeping kids at home. Starting today, you can apply to receive $200 for each child or $250 for a child with special needs. We know during these times like this we're going through, every dollar counts. I want to thank all the families and everyone who is doing their part right now to stay home and practice social distancing, to keep their kids safe and healthy, because this virus doesn't discriminate. It's highly contagious and it's deadly. So please don't take any unnecessary risks. As I've said before, and as I will continue to say, we'll get through this together. And when this is over, we'll come out of this stronger than ever before. Thank you, and God bless the people of Ontario. I'll pass it over to Minister Lecce.
Hello, everyone. Bonjour tout le monde. Without question, this is one of the biggest challenges we've faced in our generation. We are truly inspired by the way Ontarians are responding to this challenge. How ordinary people are doing extraordinary things in the service of their community and our country. From the staff at St. Michael the Archangel Elementary School in Vaughan, using the school's 3D printer to create personal protective face shields to help our frontline workers. To the students volunteering safely at the Humanity First Food Bank, dropping off food to at-risk seniors. This is the spirit of our province. In small and large ways, these actions are critical in our fight against ending the spread of COVID-19. Now, last week, as you know, on the advice of Dr. David Williams, Ontario's Chief Medical Officer of Health, our government made the difficult decision to announce these schools will stay closed until at least May 4th, and childcare centres and private schools will remain closed until at least April 13th to protect the health and safety of staff and students. These closures, along with your strict adherence to physical distancing and staying home, is saving lives. We recognize the sacrifice required, and we appreciate full well the economic difficulty this outbreak has had on so many working parents in this province. We must and can do more to help anyway. As the Premier made clear, we will do whatever it takes to ensure we get through this, which is why the Premier has launched and opened the application for the Support for Families initiative, putting money directly into the pockets of parents and guardians right across Ontario. Nous offrons une aide financière à tous les parents. All parents with children aged 0 to 12 can apply for a one-time immediate payment of $200 per child. Families and children with youth with special needs aged 0 to 21 are eligible for $250 in funding per child. Sign up right now. It should not take more than a few minutes at www.ontario.ca/support for parents. This funding is available to all Ontario residents, regardless of whether or not your child is in school or childcare or not. For parents and guardians who are already registered for the Support for Parents, those are the supports under the strike pay. If you're receiving those direct deposits due to the labor disruptions, you are automatically registered for this new funding, and the monies will flow in your accounts in the coming days. I encourage all parents to register today again at ontario.ca/support for families. And if you have questions or you have concerns, call our helpline at 1-888-444-3770. With this one-time funding, we're trying to relieve some of the financial burden Ontario families are facing at this time. This builds on other supports, as the Premier mentioned, including hydro relief, post-secondary support for students, and vital support for seniors. Our aim during these challenging times is to continue supporting the individuals impacted hardest by COVID-19. This global outbreak has disrupted family life a great deal, and our government will spare no expense supporting them in any way we can. Nous allons tout faire pour assurer la sécurité de vos enfants. In the meantime, we must work together, remain steadfast in our fight against COVID-19. Please continue to do your part in physical distancing, staying home, and washing your hands. If we do our part, we can and we will overcome this challenge with strength, unity, and compassion. Merci.
Okay, we'll go to the phone line for questions. First question.
First question comes from Allison Jones of the Canadian Press. Please go ahead.
Hi, Premier. We heard you say to a couple of outlets this morning that 3 million masks were held up. We now understand that it's 500,000 and that they've since been released. Can you just tell us more details about that, confirm the numbers, and tell us exactly what happened, what took place, why they were held up and where, and how that got sorted out?
Well, all weekend, I've been on the phone, talked to Ambassador Lighthizer. He actually called me on Sunday, had a really positive conversation with the ambassador. I've been on the phone all weekend with, and this morning with Deputy Prime Minister Freeland, and she's working around the clock to try to resolve the issue we're facing with the U.S. government. And so what I understand is we had 3 million masks that were stopped by U.S. officials coming out of 3M in South Dakota. I just was briefed not long ago saying that we were able to get 500,000 N95 masks moving forward. That should be released today and coming into Ontario. But we've been on this around the clock. I'm feeling, you know, a little more confident with the conversation with the ambassador and with the conversation we had with the Deputy Prime Minister. She's working extremely hard with, again, Vice President Pence, that seems to be handling a majority of this in the U.S. So we're grateful for anything we can get out of the U.S. And I've said right from the beginning, we're relying on the U.S. We're relying on the federal government, and I know the federal government's working hard, and we're all working around the clock on these items. So I have a little bit of optimism right now that we're going to get this resolved with the U.S. government and asking them to exempt Canada from the presidential order.
So does that mean if we do get this exemption, then that you're warning in your statement today that Ontario has about a week's worth left of PPE for the frontline workers? That can be avoided if we get this U.S. exemption, and if we don't, does that mean that 1 week deadline sort of stands, since we're waiting for the federal government orders and Ontario production is going to take a while to ramp up?
Well, it'll take a lot of pressure off us, not 100% pressure, if we can get the 3 million masks, and it would take pressure if what we're hearing, the 500,000 has been released. And I go back to trust but verify. I've heard so many numbers. Until I see physically those 500,000 landed here in Ontario, then I can report in and say we have it. I've heard in the past, it's on its way, and it wasn't on its way. So until I physically see it, then I'll report back in immediately. But I'm hearing that there are 500,000 N95s on their way.
Next question.
Next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Premier.
Hi.
Grocery stores are sending out emails and tweets encouraging people to shop early for their Easter meals, warning that Thursday is going to be very, very busy because of closures on Friday and Sunday. And while people may not be having their big get-togethers that they normally would, they still want to have a traditional Easter meal. So should these stores maybe be open on the holiday to avoid a rush of shoppers? And have you spoken with grocery delivery services to see if they're prepared to handle orders on the holiday?
Well, I'll reach out to our Minister, Vic Fedeli. He's taking care of that end of things. I'll also make personal calls. I have the numbers of all the CEOs of the big 6 chains, and I'll ask them if they can stay open, because I think it's absolutely critical, and they've been doing an incredible job. But you make a very good point on that when it comes to Easter or Passover. Get your shopping done earlier for anyone, and I know it's very, very tough times right now, but if anyone, if they have the money and they can order takeout and get it delivered or picked up, it takes the pressure off the retail system as well, and also puts a little bit of money into these restaurants that are struggling to keep afloat.
And my follow-up question, Quebec has launched a website for people to find and support local businesses. The Quebec government says it wants to be the Amazon of local shopping. Is your government looking at doing something similar to support local businesses here?
Well, we're doing everything we can to make sure that we support local businesses. I just got off the phone with Francois Legault approximately an hour ago. I was not to jump the question here, but I asked him if he had any N95 masks to ship over. He'd get back to me, but we're doing everything we can, working in conjunction with the federal government to help small businesses on deferrals of taxes, on lowering their electricity rates. We're trying to help them every which way we can.
Next question.
Next question comes from Travis Dunraj of Global News. Please go ahead.
Hey there, Premier.
Hi, Travis.
Can you just explain the mask situation a little bit further? Because we're hearing conflicting numbers. What's the total amount of masks that you have on order from 3M? And just talk about President Trump's order and how difficult that has been making the situation at the border.
Well, getting it across the border right now is very difficult, but again, things could change rapidly with the discussions. Right now, I understand there's 2 separate orders of close to 4 million masks. 500,000 have been released, but again, Travis, as you're hearing or as I'm hearing the numbers, I'm passing them along and just trying to get the accurate numbers coming across the border. They seem to be changing a little bit, not drastically, but we just need the federal government down in the U.S. to exempt us, and I think we're getting extremely close. And I know after my conversation with Ambassador Lighthizer, he gave me a glimmer of hope. You know, he agrees. We've got to help our neighbors, part of the family, I told him, like I said in my press conference. And I know Chrystia Freeland, Deputy Prime Minister, is working around the clock, making sure that she's doing everything she can to get the green light from the administration in the U.S. So everyone is doing everything we can. On top of it, we're using all our contacts around the world, our embassies over in Asia, no matter what country it is, be it China or South Korea or any of the other countries that may have masks. We're working on contacts over in the UK. There's not a region in this world that we don't have someone out there looking for these N95 masks. The good news, there's some good news that Health Canada has approved Woodbridge masks. They're at level 3 masks, and so that's good news. I'll be bringing some of those in tomorrow to show the folks that here, you know, we've been talking about these masks. Here are some physical masks that we have right now. So that is good news. The other area on reagent and the Spartan test, through conversations that Deputy Premier and Minister of Health, Christine Elliott's been working with the Minister of Health federally, trying to speed up this approval through Health Canada. We have 900,000 kits of these Spartan kits that we can get out there and start testing people.
And on Saturday, you said that Health Canada was slow to approve domestic manufacturing. So what you're saying now is that has changed, and how are things going with the Health Canada and the province?
Well, I don't know if it's changed so much, but I did mention about rattling some cages, and I guess Chrystia went up there and did that. You know, I say Chrystia is a firecracker. When she's onto something, I should say, I apologize, Deputy Prime Minister is a firecracker. She's out there going full steam on this, and sometimes you have to push the system a little harder. And I want to thank the people of Health Canada. They're under tremendous pressure right now. Everyone's giving them everything to test and get it done right away. We want to make sure it's done properly, but efficiently, and to move things along as quickly as possible. So, you know, as much as I say you have to rattle cages, I appreciate the job that the folks up in Health Canada are working around the clock to get these approvals done as soon as possible. But we did have a little bit of a win this weekend with the masks.
Next question.
Next question comes from Mike Crawley from CBC News. Please go ahead.
Hi, Premier. I'm wondering, given that it was only about 10 days ago that you and Health Minister Elliott were somewhat downplaying the reports of rationing of personal protective equipment coming out of hospitals, what responsibility do you take for the lack of supply? What responsibility does your government take for this shortage of personal protective equipment?
Well, Mike, first of all, I want to correct you. I've never once downplayed it. I know you've asked the minister before, and she's answered honestly that the time we had enough masks. You have to understand, Mike, this is changing hour by hour, day by day. The more people we get tested, more masks we're using. I've always said from day one, we're relying on the federal government and our supply coming in from all over the world. And when everyone's going after the same items, it makes it a lot more challenging. And it's always going to be challenging moving forward until we have our own supply, our own manufacturer, which we're getting close to that point. But again, it's a challenge to get this PPE items to the front line. But we're ramping up on all fronts, from manufacturers. Yesterday, I went to a surgical gown manufacturer. We have 3 or 4 companies that are offering to do surgical gowns. So this is all that's on my mind. I don't sleep at night thinking about these PPEs.
My follow-up is for Minister Elliott. It's in regards to Telehealth Ontario. We're hearing that although people are able to get through now to the telehealth line a lot more quickly, the person that they end up speaking to at first is basically an intake person who's not a nurse, and that the wait to get a call back from an actual nurse is now 2 to 3 days. What's your response to that, and what's your explanation? What do you say to people who are having to wait up to 3 days to hear back from a nurse?
Well, the volume has decreased somewhat, but waiting through 3 days is not acceptable. We really want to get that down to within 24 hours. So that's something that we're continuing to work on. But I think the other point to be made is that because people can now call their family physicians and they can have a teleconference with them with respect to their health, that I think a lot of the calls are now going directly to family doctors who have a history with a particular patient anyway, and they can now give that information to them in a much more timely manner. So we're going to continue to work on telehealth, but I think right now for people to call their own family doctor is probably a more timely way to deal with it.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, Premier and Health Minister. Every day you guys get a daily snapshot of just how much PPE is out there. So I'm wondering if you can get very specific for us. What supplies is Ontario specifically running on that healthcare workers need, like N95 masks, surgical masks, gloves, face shields? What specifically are we running low on? And can you give us a snapshot of what supply we actually have?
Well, we go by different codes, and right now they're all red, meaning we need all of them. And there's probably six items, as you mentioned: the surgical masks, the level 2 masks, the N95s, the gowns, surgical gowns, also the reagent, the testing kits, the face shields. And the face shields seem, if anything, to be moving along at a pretty good rate, because we have quite a few people out there able to make the face shields. So the real tough ones to get are the level 2 surgical masks and the N95 masks. So those are the ones that we really focus on, and the surgical gowns as well.
So obviously we're hoping that we're not going to be in a situation where we run out of N95 masks. But what happens, what directives are being given out to hospitals right now if the hospital runs out of N95 masks or surgical masks? What are frontline healthcare workers who come into direct contact with COVID-19 patients, what are they expected to do if they don't actually have that protective facial equipment?
Well, we aren't at that point right now. I'll just give you an idea what Quebec is doing right now. They're sanitizing and reusing the masks. They're reusing them 4 or 5 times. We aren't at that point yet, but that's exactly what they're doing. And Premier Legault asked me if we're doing it, and I said, we're thinking about, but we haven't done it yet. He says it's critical. They're safe once you put them through the system and make sure they're fully sanitized. Then they should be able to reuse them. But we aren't at that point right now, and I still have confidence, Colin, that we're gonna get these masks in. And the other area is distribution. We're pulling in counts and numbers from 140 hospitals, and on top of that, long-term care homes, seniors' homes, to make sure we're managing this properly. Some have more than others, but we need to make sure we have accurate numbers from all the hospitals and long-term care folks there until we can measure it better.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Thank you so much. Thank you, Premier. I'm wondering if we can return to Travis's question about the number of masks. You said close to 4 million of them had been ordered and 500,000 have or will be released. First, I want to clarify, were these all ordered from 3M?
Well, through 3M in Ackland Granger, which is a distribution arm of 3M. So there's a couple orders placed, and so far, what I found out before I came in here, that 500,000 were released. Again, we're on the line with the U.S. federal government. The Deputy Prime Minister is. I'm doing everything I can through Ambassador Lighthizer. I just sent him a message. I'll be talking to him after this meeting. We're putting pressure on the U.S. government from all sides. It's absolutely critical that they exempt Canada from this presidential order.
And Premier, why only 500,000 of a potential 3 or 4 million order in terms of, you know, the number of masks? Why were only 500,000 released? And I know you mentioned you're speaking to your officials. What do you do to ensure this doesn't happen again? You don't go through this again in a few days.
Well, we have to make sure that we have the supply. Through a real wrench into things when the U.S. Closed down their borders on this. But we're reaching out to everyone in the world right now, Christina, to make sure that we have enough masks. And I don't want to be crying wolf, you know, unless it's real. And I'm being honest. It's serious. We're down to a week. If this 500,000 comes in, that will buy us another week. But it's everyone right across the province. As talking to the Premier of Newfoundland this morning, he's asking us for masks. Everyone seems to be requiring these N95 masks right now, but I still have a little bit of hope here that we're going to get these in. I just don't give up. As I said, I'll be on this like a dog on a bone. I will not stop day in and day out until we continue on with the supply. But it's certain items that the whole world is trying to get their hands on right now, and we're doing exactly the same thing.
Next question.
Next question comes from Robert Benzie from the Toronto Star. Please go ahead.
Good afternoon, Premier. I know you said at the outset that you were concerned that people were still going out and about. On the weekend, we saw 800 cars turned away from Bluffers Park in Scarborough. We had 150 cars turned away at Hyde Park. Yep. The cherry blossoms are, of course, coming out in Hyde Park and in Trinity Bellwoods Park. Is it time to have a mandatory stay-home order because the weather is getting better and people are still going out despite your warnings?
Well, Robert, it's made a good question. You know, vast majority of the people are listening and have a mandatory order. That's pretty tough. And in saying that, vast majority of people are cooperating. I just don't understand what people are thinking that go to these parks and even along the the lakeshore when they're jogging. And I have in the past said, yes, go out for a walk, go around your local neighborhood, walk around the block. You have to walk your dog. I understand it, but don't be going down to the main path on the lakeshore. Let me tell you this, what I've heard from the doctors. A jogger is going along or people walking, someone sneezes. It goes on the sidewalk. You don't know. You walk over it, and if they have COVID, all of a sudden you're carrying it home on the bottom of your shoes. Or a jogger might spit, and you accidentally walk over it. You're putting everyone in jeopardy. We're running ads. The media has been phenomenal, getting the message out there. We're out there every day, the feds, the municipalities. What don't they understand? I don't understand how people still are showing up to these parks. You know, you don't like being, the heavy hand that comes down and find these people. We went to the warning situation. They're being warned. Maybe the next step is to lay some charges. Some hefty fines. But why? Why do we have to go this way when vast majority of Ontarians are listening and they're doing a great job and they're self-isolating? It's a shame a handful can ruin it for everyone.
And on another subject, today in Ottawa, the Chief Medical Officer of Health of Canada is saying that now non-medical masks, so not the ones that we have the shortages of, but non-medical fabric masks, things like that, are not a bad idea to wear in public. Does the Ontario government, or do you have an opinion on whether that's something that you'd like to see? Not N95 masks people wearing, or anything that
so until the person doesn't
need,
spread
but
it.
yeah.
No, I understand. I think it's a good idea. If you can make them, by all means. If you can get your hands on some, by all means. But with the government items, we have to make sure the frontline healthcare workers get those masks. But I think it was a good point the Chief Medical Officer of our country mentioned today. So where you can protect yourself, even makeshift, one at home, I'd do it. It can help people.
Okay, this will be the last question.
Last question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, I'm wondering if you can talk to me, yourself and the minister, both of you, about the National Emergency Strategic Stockpile. Minister Hajdu admitted last week that it wasn't sufficiently supplied. This is supposed to be the federal backstop so that things like you scrambling to get masks for the province don't happen. Has Ontario been able to draw down on this? Have you had discussions with the federal government about this particular program?
Yeah, we have actually. Again, I was dealing with the Deputy Prime Minister about it, and they don't have a big warehouse full of items. When they're getting them out in the field as quickly as possible. So there's no big room full of masks that they're holding on to. They're moving as quickly as possible. And as well, when masks come in from around the world, we have to make sure they're tested as well. And there's a lot of fraud happening out there. You can just imagine with a commodity that everyone wants. So when they come in, then we do our spot audits throughout the shipment, and to make sure that the masks are real N95 masks. So they have to be tested, and that usually takes a couple days. But to answer your question, what I know, the federal government doesn't have a big stockpile of these items. They're getting them out to the field immediately.
Follow up?
And Premier, do you have a sense of how long it will take Woodbridge to ramp up production? Are we talking days, weeks, months? We've heard of a company out of Pointe Claire, Quebec, that is going to be making masks, but they won't be online until July. What have the folks at Woodbridge told you on when they can have product ready for the people of Ontario?
Well, they're going to send me in a couple thousand, the prototypes that they have. I talked to Martin, and by the way, Martin and this whole team are doing an incredible job at Woodbridge. As he's saying, he's working around the clock, and he hears me go out every day and say, we're getting these finally. We have prototypes, and I'm going to bring them in tomorrow to show people, and I don't want to give you an exact figure, but they're going to start ramping up, going full steam ahead on it, and I'll have better figures when I bring in the mask tomorrow to give you an exact count. But it's a positive news story. We're up here every day. You're hearing some bleak comments sometimes saying, hey, but there is light at the end of the tunnel. We are going to get through this. We've hit a few bumps in the road, but I'm confident we're going to get through this. We will have the masks, and we're just keeping people informed on a daily basis. And Brian, I'm just being transparent. The numbers I hear, and you can imagine some days it gets frustrating because you hear one number and the feds hear one number, because we have this conversation, Deputy Prime Minister and I, and all of a sudden, an hour later, the shipment coming in from Asia, it got held up, and then numbers change. So everything I'm hearing, I'm passing it along, and yeah, there are times it gets frustrating, but I also have to say there's hope. There's hope. We're going to get through this, and we are going to get these supplies, because I will not give up. I'll never give up, and we're hunting around the world for for these supplies, and every day I'll give you an update on where we are. But I want to thank everyone in Ontario for pitching in, and the companies, the endless companies that are calling up and saying we can make gowns, we can make masks, we can make shields. Just keep it going. I give a shout out to Ford Motor Company that have their assembly line pumping out these face shields now as well. And so let's together we'll make sure we have the supplies. But I want to thank everyone. Thank you, and God bless you. Thanks.
Thank you.